Welcome back. Voters approved Prop 36 by a wide margin back in November. It toughened up penalties for repeat retail theft and drug offenses. A big selling point for District Attorney Summer Stephan was the option for treatment instead of jail time. It took the county 4 months to get that Prop 36 specific treatment plan up and running. DA Stephan is in studio now. Thank you so much for being here.
Thank you.
Why did it take 4 months to get that treatment plan specifically for Prop 36 offenders off the ground?
Well, I'm actually very proud because we're way ahead of the rest of the state. 4 months to create something new, specific for a new law is showing that the stakeholders took this seriously, that the will of the people was important, that our health and human services, our court leadership, our public defender, probation, sheriff, DA, all of these agencies got together and devised a system that can be applied whether a defendant is in North County, South County, East County, or Central, because our focus was that justice has to be even across this county. This county is larger than 21 states, so to be able to provide that system-wide treatment is really something great. Before that time, we still provided treatment, but it was not consistent and across the board.
So yeah, what was happening to people who were prosecuted under Prop 36 during that interim period, those 4 months?
They were always allowed the chance to engage in treatment. Some of them chose treatment. Fortunately, and maybe unfortunately, and one of the reasons that I really thought Prop 36 was needed is we have a very successful drug court, and the numbers in there were not good. It was half full because there was no incentive under our old laws to choose treatment. Addiction is tough and treatment is tough. And so when you don't give people options, when you just tell them, here's your citation time and time again, they were not choosing treatment. So we had room in the drug courts. As we were filling that room, we were working simultaneously on a system-wide treatment specific for this population.
And what does that look like?
So it first, in court, there's this a system-wide form where the defendant, after being advised by their attorney, can choose treatment. They agree to an assessment. Somebody from behavioral health, who's been a terrific partner, does an assessment. That assessment tells the doctor what is the level of care needed, and based on that level of care, they are sent to a provider that can give that level of care. Sometimes it's outpatient, inpatient, a detox is needed, a sober living. It varies across the board, but the beauty of Prop 36 is it was individualized treatment, and it's working. So far, just even since April 7, 65 people have accepted treatment under this new system-wide approach.
This was approved by voters in November. It went into effect in December. Should there have been a longer runway to give the county more time to prepare before this was implemented?
I think that we needed this 5 years ago. We have a terrible problem. Our homeless people are dying at 117 times higher rate than people who aren't homeless. To have left people more time with weak laws that don't incentivize treatment is something that I was against, and I tried for years with the legislature to get a fix. They wouldn't budge, and so we had to take it to the people. And the people did the right thing by 68% vote. And let's not forget the repeat thieves. I look forward to the day when all of the items in our stores are unlocked, because now there's actually an accountability for those stealing those products. I'm already hearing from store owners. I was at a 7-Eleven, and the owner there came out and gave me a big hug because finally she can call police and something is going to take place.
Is there enough treatment capacity in the county?
We don't know whether we have that or not. So we're tracking this very closely. Our data is going to be transparent. I've directed my team to make sure that we track this data so that we can tell what is needed. We have enough treatment beds right now and treatment space, but we're asking Sacramento, and unfortunately the budget that was put out this week does not have monies for Prop 36. It should have monies for Prop 36. There is nothing that indicates the will of the people more than the laws. And when you have 58 counties voting, this should be a priority for budgeting. So we should be thinking ahead for when we might run out of room, which is actually a positive indication that people are finally accepting treatment. But we should be ready with more treatment beds.
I know you were expecting some Prop 1 funds to support Prop 36. Have you received any of those? Has the state ponied up?
Not yet, but Prop 1 funds have been allocated to our county, and I've requested that those funds, which are actually a match made in heaven for this population, because we're seeing the intersection of mental health, homelessness, and addiction. And that's what that money is for. So millions have been allocated to our county, and we are asking that some of that is apportioned for the Prop 36 population.
Why hasn't that happened yet?
As you know, the county is still going through their budget process. It doesn't get confirmed till October. They're in that process. So I'm hopeful that they are listening to my request, because it is, it's just looking ahead and making sure that we accomplish the will of the people. Some, politicians did not support Prop 36. It really is irrelevant. It is law, and it's the duty of government to fulfill that will of the people.
As you're calling on Sacramento to fund Prop 36, what can you tell them? What can you tell our viewers that money will be put towards?
That money will be put towards multiple things, but one of the things that we need is for the Sheriff's Department to be supported, because Prop 36 means more people are in custody until they're evaluated for treatment, both on the theft side and on the drug side. And that means that the sheriff needs more capacity to make sure that they already begin providing that addiction treatment, the medically assisted treatment, all of those things. In addition, more money is to be put into generally treatment beds, treatment assessment. For my office, it is also more work, but I'm actually trying to prioritize the services, and my team is so excited about being able to continue to serve the community that they've just doubled up on their job, and I haven't heard any complaints yet. But sure, if there is a little extra money, we will take it, but we first want to prioritize treatment.
Are you concerned about racial inequities in the prosecutions under Prop 36?
I feel very confident with my police chiefs and sheriffs that they are going after the crime and not after the individual. They are trying to address crime in our communities, rampant drug use in encampments. That, by the way, is something that we don't talk enough about, but something I tracked and presented for the U.S. Supreme Court, is that a full 50% of our arsons are being caused in encampments and by individuals experiencing homelessness. So, and that includes drugs and the fact that you're not thinking straight when you're on drugs. So this is a big priority, and that's what they're addressing, law enforcement. It's the crime and not the individual.
DA Stephan, thank you so much for your time this morning. We really appreciate having you here.
Thank you.
And coming up, the state has budget blues of its own, and undocumented immigrants may pay part of the price. Stick around.